Guidelines of most medical societies recommend 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week for health benefits. High intensity interval training HIIT is another efficient exercise protocol with short sessions being increasingly recognized to have benefits for general health as well as primary and secondary cardiovascular prevention. HIIT has been classified into aerobic HIIT and anaerobic HIIT. The latter is also known as sprint interval training SIT. Saintex CAD study compared aerobic interval training with moderate continuous training. 200 patients with coronary artery disease and left ventricular ejection fraction above 40% were randomized to a supervised cardiac rehabilitation program of 3 weekly sessions of either aerobic interval training at 90 to 95% of peak heart rate or aerobic continuous training at 70 to 75% of peak heart rate on a bicycle. Primary outcome was VO2 peak and secondary outcomes were peripheral endothelial function, cardiovascular risk factors, quality of life and safety. Similar improvements in exercise capacity and peripheral endothelial function was noted in both groups. Quality of life and cardiovascular risk factors including diastolic blood pressure and high density lipoprotein cholesterol improved significantly after training in both groups. An earlier, smaller study in 27 stable post-infarction heart failure patients on optimal medical treatment had also come to similar conclusions. They had a mean left ventricular ejection fraction of 29%. Mean age of the patients was 75.5 plus minus 11.1 years. They were randomized to either moderate continuous training or aerobic interval training 3 times per week for 12 weeks or to a control group that received standard advice regarding physical activity. Increase in VO2 peak was 46% in aerobic interval training, while it was 14% in the moderate continuous training, P less than 0.001. This was associated with reverse left ventricular remodeling. Improvement in endothelial function and quality of life was also documented in that study. These HIIT protocols require a shorter exercise duration to obtain the same benefit as that provided by moderate intensity exercise. Aerobic HIIT consists of intermittent bursts of vigorous activity of 70 to 90% of VO2 peak or 85% to 95% of the peak heart rate interspersed with active rest periods. 4 into 4 minute or 10 into 1 minute protocols are commonly used for HIIT. One Wingate type protocol of SIT is 4 to 7 sessions of all-out vigorous intensity exercise for 30 seconds interspersed with 4 minutes of complete rest. Anaerobic SIT protocol involves exercise intensity 350% of VO2 peak. Obviously, these high-intensity protocols are quite demanding even though the intensity is adapted to the individual's aerobic capacity. The risks of these high-intensity protocols are a concern and certainly more studies are needed. Supervised workout is mandatory initially in the case of HIIT till the participants are accustomed to the intensity. Heart rate is measured with a wearable heart rate monitor during the exercise to make sure that the permitted limits are not exceeded. In aerobic HIIT, the recommended peak heart rate is 85 to 90% of the age predicted maximal heart rate. Age predicted maximal heart rate is calculated as 220 minus age of the person in years. Medical opinion from the regular physician is mandatory before starting supervised HIIT programs in those with existing heart disease or any other significant medical problem. Home-based HIIT programs are possible if sufficient support is provided by experienced centers. Here are the first set of journal references. Second set of journal references. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.